Welcome to Vertical Movement PT. I'm Dr. Cindy, physical therapist. Today, we are going to do a routine to help reduce low back pain. So go ahead and grab a mat or find a comfy place where you can lie down and let's get to it. We are going to start with the soft tissue mobilization section of this routine. So go ahead and grab a ball, a lacrosse ball, tennis ball, even a golf ball, but just make sure that it isn't dirty because we're going to put it up against the wall. And I made that mistake and there's some spots on our wall. So we're going to go over two muscles in the low back that it's very common for those to get tight and lead to low back pain. So one of the muscles we're going to go over is the Quadratus Lumburom, and that muscle connects to the posterior iliac crest, so right over here, and it connects to the lumbar spine from L5 all the way to L1, and also inserts on our 12th rib. So the lumbar, or the Quadratus Lumburom muscle is about right over here. And what you're going to do, you're going to grab the ball, and if you have the pain on the right side or the left side, because the muscle is on both sides, you're going to place the ball right where you feel like it's sore. But generally, you want to work the whole muscle. So starting from the origin to the insertion and the insertion, okay? And even you can get the muscle belly. Muscle belly means the middle of the muscle. So you're going to go ahead and place it right on that muscle there. And you're going to go ahead and go side to side, do a little booty shake. And when you find a spot that, oop, that's my spot, when you feel like it's sore or tender, you're gonna stop right there and you're gonna go ahead and sink into the ball a little bit more. And while you're there, you just wanna hang out for about 5 seconds before you move on to the next spot. So you can go ahead and do this for about 1 to 5 minutes on both sides. And you just don't wanna do it too much because you can overdo it. There's definitely always overdoing it of some sort of exercise or soft tissue. Okay, so the Quadratus Lumburom, that muscle is in charge of side bending, for us going side to side. So that muscle gets tight whenever we stand, like the lean, we're on a standing desk, or if we just have like a lean when we walk. I don't know, people walk like that. So keep that in mind, okay? And you want to correct that posture to solve the original problem. This is just to put a band-aid on the injury, but to solve the problem, you have to actually fix the posture. So the next muscle we're going to go over is the Erector Spinae, and that muscle is not just one muscle, but it's a group of muscles. And it connects from the sacrum and goes all the way up the spine, even goes up to the neck. And there's three groups for this muscle. The spinalis, so that's closest to the spine. And then we have the longissimus. And then we have the iliocostalis. So the Quadratus Lumborum's out here, and the Erector Spinae is more along the side of the spine. That muscle is in charge of extending our spine to going backwards. So if you find that you have a posture where you're kind of like sticking your butt out, and you tend to kind of stick your belly out, and then you have that low back pain along your spine, you're probably over activating your Erector Spinae. So you can go ahead and use the ball, place it right on the spot where you feel that knot, where you feel the muscle tension. And you're gonna do something similar, but this time except going side to side. You're gonna go down and up, kind of like doing little squats. And then when you find that sore spot, you can go ahead and just sink the ball into there. So you can do this for about 1 to 5 minutes also for each side. But you can go ahead and pause the video now if you want to go ahead and roll out a little bit before you continue to the stretches and exercises. All right, we are going to move on to our stretching routine. So go ahead and lie down on your mat or a firm surface. And we're going to start off with double knees to chest. You're gonna go ahead and grab your knees and bring them to your chest. If you're not able to bend your knees as much, you can go ahead and grab underneath your thighs, just like that. Or even if that's too much, you can grab a towel or like a stretching strap, put that around, and you can bring your knees to your chest. Okay? And you're gonna hold this for about 30 seconds, going side to side, and this is like a little massage to your low back muscles when you're going side to side. It's also stretching the Quadratus Lumburom, the Erector Spinae, helping with your pelvis mobility. This one probably feels really good after a long day of sitting at your desk. Okay, go ahead, and now we're going to move on to single leg to your chest. Oops, scoot back a little bit, and you're going to bring your right leg up to your chest and let your left leg go down. So this, you're probably going to feel a nice stretch in your left hip as well as in your right lower back. If you're feeling pinching in your hip here, you can go ahead and lay off bringing your knee to your chest. You can ease up a little bit. Okay. Go ahead and slowly switch to the other side. Straightening your right leg and bringing your left knee to your chest. So you should feel a nice stretch here in your right hip and a stretch in your left lower back. You can go ahead and even play around with the direction of which direction you bring your knee. You might feel the stretch more in your back if you bring it more to the right, or if you bring it more outside of your body. You can kind of see what works best for you. Okay. So now we're going to go ahead and move on to the hamstring stretch. So go ahead and spread your feet a little bit outside of the mat or outside of your hips, and you're going to stretch down the middle. The hamstring, it connects to the ischial tuberosity, and that's the sit bone right here in your pelvis. When the hamstrings are tight, it can actually pull on your low back, causing it to have a rounded shape. And you're supposed to have a slight curve in your low back going that direction, but sometimes people have poor postures and they have more of a rounded position, which isn't a good thing. So by stretching out the hamstring, it helps release that tension so that your lumbar spine can go into its neutral position. Okay, let's go ahead and move on to the right side. Ooh. If you can touch your toes, go for it. If not, the shins is awesome. Don't judge yourself too hard. You should be proud of yourself that you're even trying and you're taking the steps towards a healthier lifestyle. This one you'll also feel in your low back as well as underneath your thigh and your hamstrings. And if you pull on your toes, you'll probably feel a nice stretch underneath your calf. Okay, let's switch on to the left side. Same thing. Feel a hamstring stretch, calf stretch, and even a stretch here on your right Quadratus Lumburom, Erector Spinae, all that fun stuff. If you can let your head fall forward, you can also feel a nice stretch in your upper back. Okay, so next we're going to move on to something called hip twisters. And you're going to lay down on your back. You're going to have your feet spread apart where they're outside of the mat or where they're outside of your hip. And for hip twisters, this is important because it helps mobilize your hips. So you're going to go ahead and drop your knees to the right side. Your left knee should fall in the middle. And then you're going to go ahead and switch to the other side. dropping your knee to the left. You want to make sure that your low back does not lift up off of the ground, and you want to make sure to stabilize your core, pushing your low back into the ground. The reason is because we want to get all of the mobility here in your hips. So one of the reasons why people get low back pain is when their hips, they're not mobile and they're not moving the way that they should. So what happens is that your body steals the movement from your low back since your hips aren't doing the job. So it's very important to keep those hips mobile for a healthy back. Side to side, and as you're going side to side and you feel your hips loosening up, go ahead and sink into that new movement. Trying to get more range of motion. But you want to make sure that you're not forcing any of these exercises or stretches. You want to meet yourself where your body is at. And that's the place that you should be. But with practice, you can improve. All right, very good. Okay, so next we're gonna move on to cat-cow. And this is a popular yoga pose. And I love this one because it helps mobilize the whole spine. So you're gonna go on all fours. If you happen to have bad knees, you can put a pillow underneath your knee, or you can find like a nice soft surface. Try to avoid doing this on the bed because the bed is too soft and you'll sink in. Firm surface is better. Okay, so you're gonna go on all fours, have the top of your feet on the ground, and you're gonna go ahead and arch your back up like an angry cat, dropping your head down. And then you're gonna dip your back down and lift your head up like a cow. And switch. So with this one, the goal is to have a movement where all of your vertebrae are moving together. It's really common for only certain segments of your spine to be moving and some segments to be stiff. But the goal is to have a nice, beautiful U. And what I see commonly is people having like this sharp bend in the lumbar spine and their thoracic spine, their upper back isn't moving. But you want to make sure to get all of the spine moving evenly. So upper back, thoracic spine. Make sure you're not overemphasizing in your neck like this, overextending. Nope, you just want it to be nice and gentle. And switch. Very good. This is a wonderful exercise to do first thing in the morning to get your spine loose. It really makes a difference for the rest of your day by just doing a simple exercise to set up your spine for the day. If you don't believe me, give it a try. Try 20 of these first thing when you wake up and just see if there's a difference. And as you find that you start getting more mobile, go ahead and try to sink into that new range of motion. If you find an area that's a little bit more tight and sore, you can go ahead and just stop in that position and hold that stretch. Good, let's go ahead and do one more. All right. Okay, next we're gonna go ahead and move on to open books. So go ahead and grab a pillow. We're gonna start off on our left side. The bottom arm is gonna go straight out, top arm right on top, hips flexed and knees bent. And you're gonna go ahead and rotate to the opposite side. Make sure your head is following your hands, and you're gonna come back forward. This is a great mobility exercise to open up your rib cage, to open up your chest, and to improve the mobility of your spine, all the way from your neck down to your sacrum. And if something's in your way, like me, like there's this wall, you can go ahead and bend your elbow, and that's okay. We're gonna go ahead and do about 4 more for a total of 10. And if your arm doesn't touch the ground, that's okay. You don't want to force it. None of these exercises should hurt. And everything should be nice and gentle. And all you have to do is just keep practicing this routine until you get more mobile. Okay? So now we're gonna go ahead and move on to the open book stretch. So with the bottom hand, go ahead and grab your knees. In the other hand, you're gonna go ahead and rotate to the other side and hold that stretch. You can also grab your hand, use your hand here and grab your pelvis and bring your pelvis forward to the opposite side to where your right hand is. You're gonna feel a deeper stretch in that low back and along that spine. You're gonna hold the stretch for about 30 seconds. And then now let's go ahead and move on to the other side. Okay, laying on your right side, bottom hand straight out, left hand right on top, hips bent, knees bent, and you're gonna go ahead and rotate all the way to the other side. You might hear some popping and crackling, and that might feel really good for you. Like a nice release. Whew. I definitely feel some popping. Okay. And make sure your head is following your hands. Very nice. And as you get more flexible, go ahead and make sure to move into that new range. You want to make sure that each movement is a quality movement where you're paying attention to what you're doing. And really trying to get the most of each movement. Okay. And now you're going to go ahead and hold the stretch for an open book stretch. Using your opposite hand, and you can place it on your pelvis or your thigh, and pulling your pelvis to the opposite side, nice and gently. And keep in mind, more isn't better. The saying that I don't agree with is no pain, no gain. What is it? No pain, no gain. I don't like that because a lot of times that is why people get injured. They overdo it. All right, good job. So the last stretch I want to do of our stretching portion of this routine is stretching the hip flexors. So you're going to go ahead and stand in a lunge position. So the hip flexors includes the psoas, and that connects to the lumbar spine, right? So you're going to go ahead and lunge position and lunge forward. Go ahead and with your pelvis, you're going to tuck it in between your legs, just like this, like bringing your tailbone in between your legs. And you're going to feel that nice stretch here in your hip. And this is a great one for people who sit too much or who have long car commutes, who watch too much TV. This helps release that tension that could be contributing to your low back pain. Okay, let's go ahead and switch to the other side. And just make sure that back foot, there's a tendency for it to go out like that. It goes out like this. Double check it and make sure that it's straight forward. You'll feel the stretch a lot more. Forward. You should feel it right here. If you don't feel it, tuck that tailbone in between your legs. and you'll definitely feel it more. Hold the stretch here for 30 seconds. This is a great one to do every hour if you're working at a desk. Get up, do the stretch 30 seconds each side. You'll feel better at the end of the day. You really will. Okay, awesome. So the last portion of our routine is going to focus on strengthening our core and strengthening our glutes. That's very important to have a nice and healthy back and to help prevent low back pain or to help resolve low back pain. So we're going to start off down on the mat. And you're going to lift your arms straight up and your legs straight up into a dead bug position. You want to make sure to keep your belly button in, your low back against the ground, engaging your transverse abdominis muscle. I like to call it the human anatomical corset. And you're going to hold this position for 30 seconds to a minute. If this is too easy for you, you can go ahead and add some taps. And if that's too easy for you, you can go ahead and add some arms to go opposite. You just want to make sure that low back does not lift up off of the ground. Right. And if you're doing taps, you're going to go ahead and do 10 each side. If you're doing the dead bug hold, you're going to hold it for 30 seconds or up to a minute. Good job, everybody. The transverse abdominis muscle is huge in helping to reduce low back pain or prevent low back pain. It's a muscle that's so oftenly ignored, and so often I find that it's weak in most people. Okay, so next we're going to go ahead and move on to doing bridges to work on our gluteus maximus. And that muscle is important to be strong because when it's weak, we tend to use our low back muscles for extension instead of using our glutes like we should. So go ahead and arms straight down. You're going to lift up, focusing on using your glute muscles, not your low back, and back down. If that's too hard for you, you can go ahead and do mini bridges. That's totally okay. Nothing wrong with that. But if you can't, go ahead and do the whole bridge, stretching out your hip flexors and making sure you're getting the strength from your glutes, not from your low back. Squeezing your butt cheeks together. You're going to go ahead and do 10 of these. If this is too easy, you can go ahead and try doing it with one leg. But you just want to make sure your pelvis isn't dipping like that. You want to make sure it's nice and straight. And if that's the case, if you do it with one leg, do 10 each side, okay? So that you're not oblong or, what's it called? Lopsided. Okay, great. Now let's go ahead and go back to doing the dead bugs. So you're gonna make sure your low back's pushed into the ground. You're gonna engage your transverse abdominis, your anatomical human corset. If this is too easy, add the taps. If that's too easy, add the arms. Just really focusing on that core engagement. Good job, everybody. If you're getting any sort of low back pain, go ahead and bring your legs down, and you can go ahead and just do a simpler version, or you can just stay with the dead bugs, the dead bug hold position. But you don't want to have any pain with any of these exercises, okay? Okay, great. So now let's go ahead and we're gonna finish off with one more set of bridges. The end is near, and you are awesome. Just remember
Squeeze your buns of steel and not your low back muscles. Do the mini bridges, don't forget that option. Or if that's too easy and you've been doing this routine for a while, you could do single leg bridges. Just making sure to do an even amount on each side. 10 each side. Okay, so let's just do a few more. Glutes galore. And last one.
You are done, you did it, you finished the low back routine, and I am so proud of you. You can go ahead and do this routine about 1 to 3 times a week for 6 weeks, and then you can experience a huge change in your low back pain. If after doing this routine for 6 weeks and you're not experiencing a difference, please see your local physical therapist because you need a more detailed plan that's specific to you. But okay, I hope you have a wonderful day, and I will see you next time.